This was a 1-year-old child with severe practice act by term. Due to severe breathing problems, the surgery had to be completed as soon as possible. We used one procedure for correction and obtained satisfactory results. The child, who was only 1 year old, was found to have depressed arterial chest wall and a lack of oxygen after birth. He was diagnosed with severe practice act by term. Due to severe abnormal breathing and hypoxia, he had to be rescued. From then, the child had developed a total of 5 episodes of pneumonia, each of which had severe hypoxic symptoms and had to be hospitalized for oxygen therapy, 2 of which required ventilator intubation for oxygen. When he was 6 months old, he was found to have a congenital hip dislocation and was treated with a plaster cast. Later, scoliosis was detected. In the years after birth, the child was hospitalized and rescued many times, and his family spent nearly 300,000 yuan on treatment. His family was in great distress because of the child's illness. In order to treat the child, the family went to several hospitals, but he was not treated because of his young age and his serious illness. Eventually, the child came to my hospital for treatment. Preoperative examination showed large and severe depression in anterior chest wall, obvious paradoxical breathing, and costal protrusion. There were plaster casts on the lower part of the body. Imaging studies showed a marked depression in the chest wall and a compression of the heart. The diagnosis was clear and the surgery was indicated. The surgery was performed under general anesthesia. An incision was made at the bottom of depression. The depression was perceived and then corrected with standard 1 procedure to achieve satisfactory results. This child is an extremely severe practice act by term with large and deep depression and a significant paradoxical breathing, which requires surgery as soon as possible. However, because popular nurse procedure cannot be used in children with such a young age, only 1 procedure can be used. The design of 1 procedure is completely different from nurse procedure. Using a unique tablet shaping principle that can be used to patients of any age. For younger children, this surgery is the only option, as there is no other surgical options. In the past, we have performed a large number of 1 procedures on young children with satisfactory results. The success of this child operation once again proved the sensitivity, rationality, and the effectiveness of this procedure. In the future, we will continue to use this technology to relieve the suffering of more young children. I'm Dr. Wang from China.